Hi, how are you? I'm Dr. Daniel Aneszko, and I wanted to just show you one of our amazing technologies that we offer in our office called Cone Beam CT Scan. It's one of my favorite technologies because it just tells us so much more than just a traditional X-ray does. Um, so this is an example of a 3D scan of a patient's upper and lower jaws. So the beauty of this X-ray is it allows us to see everything three-dimensionally. Everything from the roots of the teeth to the bone, width, quality, density, quantity, and everything from their sinuses, anything from below their eyes to above their chin, and to the back of the vertebrae. So let me show you an example of this patient for uh, a good illustration of what this typically would show versus a 2D X-ray, which would have a more difficult time diagnosing. So as I scroll through these images, and imagine this as like a deli slice, so we're looking at slice by slice by slice. So as I go up, here's the patient's chin. I can start seeing the roots of the teeth. As I go up to the tip of the head, there are the roots of the teeth. And then as I look in the lower left side, this patient had a root canal, and this root canal is actually failing after many years, and he's getting a recurrent infection around the tip of that root. This patient was asymptomatic, meaning he had no problems there, but it's good to catch these things because this is something that would blow up on the patient over time and turn into an abscess. And you can see that the bone density around the lesion is actually condensing, meaning that's been there for a while. And as we scroll up, you can see the actual root canal. That's how a root canal looks on this type of scan. This patient has excessive bone on the tongue side here, which is totally benign and normal. It's just nice to kind of observe that and see that over time. So these are also great baselines for us to see, to compare to 2020 versus 2025 versus maybe taking these every so often to compare and see if this lesion on this root canal is getting worse or not. So as I go up, I can start seeing now the crowns of the teeth look normal. And now here are the upper maxillary teeth. The inside of the tooth is where the nerve lives, this dark space here. So we evaluate those to make sure all of the nerves look within normal limits. And as I go up, I can now start seeing the maxillary sinuses on this patient. And as you see on the left side, this patient has inflammation in the left maxillary sinus. Again, something that we would not be able to pick up on a regular 2D X-ray. And then this is the nasal passage. And then we can look at this from different views now. So as I scroll back, there's the tip of the nose. And I'm going now to the back of the head. So you can start seeing the roots of the teeth. And again, there's that root canal. That's the problem area. That would be very difficult to find on a 2D X-ray. So at least we have a baseline. We could either be proactive and treat this lesion or just keep an eye on that and over time evaluate and see if that is growing. Is that scar tissue or is that an active infection? As I go back, again, look at the maxillary sinus. You could see the difference of the inflammation in the upper left maxillary sinus versus the right sinus, which is nice and clear. So we always want to make sure that these types of issues, like the inflammation in the sinus, is not odontogenic, meaning that it's not related to the teeth. And then last view here is a lateral view. So here you could see, again, the nasal airway. You can see the epiglottis. This kind of closes and opens depending on if the patient's breathing or eating. You can see the tongue here. So this is really great to determine if a patient has obstructive sleep apnea, where there's just too much soft tissue blocking the airway when the patient sleeps. So I hope this helps. Again, this is just a technology that we love to use in our office. It acts as a great baseline, as a great diagnostic tool. It helps us even with TMJ to be able to spot the joint and check the anatomy of the joints. It checks bone quantity, bone quality, infections. So much we can see with this. So I hope this helps. Give us a call, Water Tower Dental Care, and looking forward to meeting you. Thanks.